Hey, Dr. C here. Today I'm going to take a little bit of a departure from my usual topic of discussion, and I'm going to review an interesting article that I read just a few days ago on specific interventions which can help relieve pain, reduce disability, and improve quality of life, and improve rate of recovery. Ordinarily, I discuss things that you can do for yourself. There are a number of interventions that we as pain specialists use to treat patients with chronic pain, but these are not things that you can do for yourself. However, this was a big enough study and this was important enough data that I think that it's worth reviewing here today. This was a large study from the Oslo Pain Registry, and in this registry they described 3 separate interventions or pain procedures which can improve quality of life and reduce disability and improve function. These included spinal cord stimulation, dorsal root ganglion stimulation, and radiofrequency ablation of facet nerves. It's important to note that all 3 of these are rather long-term interventions. They all involve the use of electricity too, which is something that I've discussed in the past. It's been my observation that the things that are most beneficial for treating pain tend to involve electricity either in stimulation form or thermal form. And this is just another demonstration of the benefit of this technique. What was learned was that patients that are in a functional program or a multidisciplinary program, which means they're getting instruction in exercise, they're getting instruction in how to emotionally and behaviorally manage their pain, and they are learning all of the things that I'm basically trying to teach you in this video series, and yet they're still not getting great results. There is still some other work that can be done for them. Spinal cord stimulation involves placing electrodes directly on the back of the spinal cord inside the bones that make up the spinal canal. It's used for certain types of nociceptive and neuropathic, or what's now termed nociplastic, pain conditions. There's dorsal root ganglion stimulation, where you're targeting 1 or 2 very specific nerve roots, and by stimulating the ganglion or the cell body of these nerve roots, you can reduce pain for very specific peripheral conditions such as hernia pain or hip joint pain or knee pain or limb pain, CRPS, and then radiofrequency ablation, which is typically employed to address mechanical pain in the back and neck. And this is a technique that we use to control the pain of movement in the spine. And so if it hurts you to stand up or lean back or extend or turn your head, or if your neck locks up or your back locks up, sometimes medial branch blockade and then radiofrequency ablation can be very beneficial for getting this pain under control. What this study didn't address was durability of response, and I can tell you that response durability isn't indefinite. This means that these techniques, once done, don't last forever. The body has an ability to restore normalcy despite what we do to perturb it. So if we stimulate certain nerve fibers in the spinal cord in order to alter pain signals and pain transmission, the body and the central nervous system figure out a way to undo what we're doing. The same is true with dorsal root ganglion stimulation. It isn't long-term beneficial in every body. We used to call this tachyphylaxis, and now it goes by a number of names, but the reality is it isn't a cure-all forever. Radiofrequency ablation certainly doesn't last forever. In fact, we're happy if we can get a year or 2 of pain relief out of it, and we're learning that over time it becomes less and less effective, in part because nerves reroute. These nerves that we're deliberately ablating or trying to shut down will figure out alternative pathways so that they won't be located where we're targeting them. And techniques for finding them are fairly limited right now. There are some interesting studies being done with direct visualization through a small scope to try and identify the medial branch nerves. And even when they're identified visually, ablating them still only gives a couple of years of pain relief before the nerve restores and function returns and the pain returns. However, for patients who are simply recalcitrant to all of the self-directed things that can be done to control their pain, and there are a number, these techniques may be beneficial. I will link this study down below so that you can review it yourself. It's actually brand new data. It's information we probably have known for a long time intuitively, but it's nice to see it in print, and it's nice to see it with rather large numbers over 1,000, because the bigger the number, the lower the risk of selection bias. Doesn't completely eliminate it, but it certainly lowers it and makes it a more reliable study. So there are some things that can be done to relieve your pain if nothing else is working. They don't work in everybody, and not every technique is right for every individual. The diagnosis has to be the correct diagnosis for the intervention, but there are some interventions that can be valuable with the correct patient selection and with proper technique, and technique is very, very important. Poor surgeons get poor outcomes, good surgeons get good outcomes, and everybody doing these procedures is necessarily doing them the best way that they can be done, unfortunately. But that's the reality with human nature. But if you're in good hands, you've got a good diagnosis, and you're the right patient with the right problem in the right setting with the right doctor, these sorts of interventions can be very beneficial. I'll link this Oslo study. They'll be just down below. And if you have any questions or comments on this video, please leave them in the comment section. I do review those comments, and if there's something that I need to expand on, I'm happy to do that in future videos. I hope this information was useful to you. Please like and subscribe this video, because that's the only way I know that this information is useful to you. Thanks for watching.